Nigeria announced a first two-week lockdown with effect from April 1st in Lagos and Ogun states, as well as the FCT, as a way of curtailing the spread of COVID-19 in the country and tracing contacts of confirmed cases, of course. Now, at that time, an update from the Nigeria Center for Disease Control, NCDC, put confirmed cases of COVID-19 at 151, with 9 patients discharged and only 2 deaths recorded in 11 states of the Federation, plus the FCT. As the second two-week lockdown period comes to an end, the official numbers have risen to 1,273 confirmed cases, 239 discharged, and 40 deaths recorded in 16 states, including the FCT. Now, in his last broadcast to the nation, the President, Muhammadu Buhari, indicated that 92% of contacts of confirmed cases had been identified, while the country's testing capacity had been raised to 1,500 tests per day. The President also acknowledged the economic challenges of the lockdown, especially for those who earn daily wages. Now, as Nigerians await the next presidential broadcast, Nigeria Today focuses on an impact assessment of the 4-week lockdown. Welcome to Nigeria Today. I'm Victor Azul. To speak on the 4-week-old lockdown is a consultant family physician and medical director, Prime Care Hospital, Gwarimpa, Abuja, Dr. Iheme Ogbonnaya. Thank you for joining us.
Thank you, Victor. My pleasure, Abuja.
All right, and also joining us is a public affairs analyst, a friend of the house, Ibrahim Modibo. Welcome to Nigeria Today.
Thank you very much. Good evening, Nigeria.
All right, let's hit the bull's eye. 4 weeks down the line, what is your impact assessment, Dr. Iheme?
Well, I would think the impacts, especially as far as the lockdown is concerned, well, we have not really. We are doing well. For instance, as evidence from the cases, the scale up in the number of cases that have been tested. As at the last count, we are talking about 10,000 cases have been done by NCDC. That is good. Even though we are still expecting more, we are still expecting, because the fact still remains the issue of diagnosis, the issue of containment borders most importantly on diagnosis, especially on the testing. So I think that, yes, granted that we are doing well, there's a presidential order which try to scale up the number of cases that are done per day, and NCDC following forth, and we are seeing it. And then we are also noticing the rising number of cases, cases that are testing positive. So kudos to the lockdown as far as we are concerned, the increased number of cases. But on the other side, the economic impact of the lockdown has not been easy for many Nigerians. Especially, we are looking at people who depend on their daily hostels. So I think we need to do more, especially as far as the palliatives are concerned.
All right, it's good to hear you speak from the economic angle as well. Now, Ibrahim Modibo, given the reasons stated for the lockdown and, of course, subsequent extension, have the purposes been fulfilled or achieved, would you say?
Well, if you ask me, I would say it's a mixed grill. Mixed grill of both sadness and most probably joy. I must first and foremost commend the government for its foresight in trying to make this lockdown a sit-at-home affair. If not for it, maybe today we might have been singing a different song entirely in the country. Miss Grill, as I've said, because one, the government thought it wise that under the present circumstance of this COVID-19, which seems to look like a hurricane sweeping across the ancestral savannah, it is a deadly disease. It's a disease where you don't know where it is coming from, nor will you know where it's going to. So it's a disease that by mere contact with people, you get it, and the next person will spread to another, before you realize anything, it has gone worldwide. My sadness is still, there are some skeptics. with skeptics full of cynicism, feeling that COVID-19, it is a disease of the rich or it's an Abuja affair. So many people in the rural areas do not even believe that COVID-19 exists. But my solace is the government has taken this issue by the bull, took the bull by the horn, and it's serious about this matter. If you look at from the first week of the lockdown up to the present, if you see, honestly and sincerely, I'm so happy that although the number has been rising because of the tests and what have you, but I'm happy that the government took this initiative to curtail the excesses or the extension of this disease, bearing in mind that the people, if they were let go, like some other states have been doing now, they've started, they said, look, they don't bother, I mean, coronavirus in Abuja affair, they are not bothered. But today, look at what is happening in the states. You find in a day, some states are having, like Kano, for instance. Kano with a population of almost about 13 million. In the last 1 week, about 6 professors died.
Okay. Let's hold it there. I think there are more than 6 actually, but let's hold it there. Now, let me get back to Dr. Iheme. We'll get back to you. But now that, you know, we are aware that COVID-19 is still very much with us, would you say that the lockdown has been effective by and large in terms of, you know, the health implications?
Well, I will say from all indications, the lockdown may have not been able to achieve all it was set out to as far as health is concerned. Now, what are we talking about? The essence of a lockdown is to make sure as much as possible to reduce the level of contagiousness of the disease.
And tracing.
And of course, looking for contact, upscaling tests and all that. Now, the question now is, have we been able to do that? We are beginning to see an increase in number of cases. Now, we wouldn't know whether it is because of the increased testing now or because people are not observing the lockdown. I would think both of them are, both cases apply, both scenarios apply. You notice that a situation whereby, yes, a lockdown, like I said earlier, is supposed to be a total cessation of movement, not just vehicular, but also human traffic. But if you take a costly walk, for those of us who are essential duties, you apply the cities, you apply the roads of the city, for instance, you see that basically there is still the normal human traffic. Probably there might be
that's talking about enforcement now.
Enforcement may not be at the level we expect. Do you understand? Especially from particular times. Do you understand? You notice that early in the mornings and late in the evenings, people are still walking about freely. People do not observe those social distances we're talking about. You see people in the guise of jogging, in the guise of all kinds of manner of activities. They still go about holding hands and walking up and down. Playing football. Of course, you see them organized football leagues. So you now see that now the essence of the lockdown, as far as health implications are concerned, may not have been are not being met.
Okay.
Yes, we are increasing the testing rates. We are discovering more cases.
But there are chances that more people are
also getting infected.
It's okay. Now, Ibrahim Modibo, how bad? Some people are talking about, the economic implications, how it weighs heavily on the ordinary Nigerian. But how bad have the economic challenges been, when you weigh it side by side, a matter of life and death, like COVID-19? You were talking about Kano earlier on.
You see, there is no nation on the surface of the earth that survives in an atmosphere of despair and despondency, hopelessness and helplessness in the midst of a disease like COVID-19. No economy will survive if the people are sick. The health of a nation is determined by, the wealth of a nation is determined by the health of the people. And therefore, if you look at it, to me, honestly and sincerely, I strongly believe that the government in its wisdom has done very well by trying to, in my place, there's a saying in Fulani language, Dogudu hautataku benyanyare. That is, you cannot run and at the same time try to scratch your buttocks.
Yes, I think I understand that.
Yes, it's either you do one or you let go of the other. Therefore, it is my strongest conviction that if we are going to make sacrifices for the benefit of humanity, so be it. We know sacrifices come with a lot of problems. Financial, economic, social, and whatever. Therefore, in COVID-19, we are sacrificing for the benefit of humanity, for the benefit of ourselves, our children, and great-grandchildren yet to come. Because if we allow this hurricane, that is more dangerous than I think the World War. Because in the World War, you knew where the bullets were coming from. You knew who were your enemies. But under the present circumstances, you don't know. And there was never a time in the history since I was born, even before my great-grandfathers, where people will be locked down. You don't go to church. You don't go to mosques. You don't pray in congregation. You don't go and attend marriages.
Suspicious of family.
Yes. You don't go and attend marriages. You don't go attend any social distancing. You have to have social distancing. This is the first time that I've ever witnessed this. And therefore, based on my experience, I think the government in its magnanimity has done very well. Although we know there are economic bites, here and there, because of the problems associated with poverty, hunger, despair, and deprivation. But under the present circumstances, I am so happy that the government, in its wisdom, is trying to give palliatives to the poor of the poor, the poorest of the poor. If you look at what the FCT administration is currently doing, which I'm very much aware of, because I belong to, I head the Publicity and Advocacy Committee of the Subcommittee on Publicity. I know that the FCT administration under the current minister, they've been able to outline a very comprehensive and highly technical team that have been able to dispense some of these palliatives to the poor of the poor, because they fine-tuned the issue of palliatives to the attraction of the grassroots, bringing all the major political parties, religious leaders of both Islam and Christianity, the traditional leaders in the community, and then youth and women. So this is very central. They've gone to all the villages. They know that people. They've been able to bring out the poor of the poor, and they've been dispensing palliatives.
But there have been problems with the palliatives. I'm glad that I have you. You are now my man. I have the right man to ask this question, but I'll come back to that later, the issue of palliatives.
It's all right.
But going back to Doc, what would you think that we could do right, or perhaps something we could double up on to get things right? You said at least you admit that we have scratched the surface.
Yes, yes. I think I wouldn't want to preempt the president, the commander-in-chief, but I think it's what we have done so far. The lockdown has more or less sensitized a lot of us to the need to sit down and that COVID-19 can actually, the war against COVID-19 can actually be won. Now, I am thinking that if, like I said, not preempting what he's going to do, if we might be able to do an extended lockdown, and then, of course, the tests are scaled up. Because I was actually disturbed the other day when I read over the news that the NCDC was actually complaining about the lack of certain kits, what we call the DNA, the extractor kits, a very important component of the testing. Now, I'm wondering how bad it is, because now we notice that some of the labs have been closed. I mean, like Kano Center did not work for about 3 days. Now, and this is a situation that we are actually looking at. We must have to scale up the level of test. Now, if we must achieve this this war, if we must win this war against COVID-19, it's imperative that, in as much as, yes, we are trying to observe the lockdown, social distancing, and all prescribed measures towards fighting COVID-19, this test must also be scaled up.
All right, thank you very much. At the moment, a break beckons now, but there'll be more to talk about, trust me. Please stay.
COVID-19 transmission is mostly through droplets from sneezing and saliva. The most effective way to protect yourself from the virus is to practice good personal hygiene. Wash hands with soap under running water, or use an alcohol-based sanitizer if water is not available. Maintain at least 2 meters distance between yourself and anyone who is coughing or sneezing. Cover your mouth and nose with your elbow or tissue when you cough or sneeze. Dispose of the used tissue immediately. If you have traveled recently to a country with COVID-19 outbreak in the last 14 days and you have a fever, cough, or breathing difficulty, call NCDC toll-free numbers before going to the hospital. This message is from the National Orientation Agency.
Welcome again. You're on to Nigeria Today, and if you've just joined us, the focus is a review of the 4-week-old lockdown ahead of the presidential broadcast. And I have been joined by public affairs analyst Ibrahim Modibo and consultant family physician Dr. Iheme Ogbonnaya. Let's get back to it. In some quarters, people are calling for a total lockdown in all the states. That's a national lockdown, that is, as the only way to address, the current situation. Some others have said, well, you have to relax, the lockdown a bit so that people will not die of what they call, now referred to as hunger virus. Where lies the balance? Ibrahim Modibo.
Well, I would strongly canvass for a total lockdown. The states should be in sync and should be in rhyme with the federal government, so as to achieve the minimum standard that is required in trying to safeguard ourselves against COVID-19. Honestly and sincerely, I think the lockdown in these 3 states of Ogun, Lagos, and the FCT has done well. Agreed that, here and there are some lapses. The security people must also be commended. Honestly and sincerely, I think they're doing a wonderful job. Since morning they'll come, they'll be on that road, under this seat and what have you, up to evening. So it's likely, if you come very early, you might pass. But in the daytime, let's say from 9, 10 up to 4, they're always there. Some even up to 6. So we should commend them. Having said that, if we look at the issue of this lockdown, there are states like Kano. When they said lockdown, and Kano is a cosmopolitan city with almost over 13 million human beings in the state. It's one of the most populous in sub-Saharan Africa, west of Zambezi and south of Limpopo. If you look at the content of Kano as a metropolitan city, a city of trade and commerce, since the days of slavery, you know that this is a city that's having human capacity, human beings. But the time of the lockdown, the government they've not found it wise to say, look, let us also have a lockdown. Because some people were allowed to even go to the mosques and churches, they were allowed to move freely, and that was where the danger lies. It's, as I've stated earlier, just last week, just in a week time, about 6 professors, eggheads in the university, very brilliant professors, just died. I know Professor Ayagi of economics. I know Professor Balarabe Mekaba that died of mass communication. These were very intelligent people.
But then the state government has come out to say that this is not related to COVID-19.
You see, the danger here is, in our own case, like I'm a Muslim, and by virtue of our own religious beliefs, if somebody dies, burial is done immediately. There is no autopsy to test as to know the cause of death, except if a consultant like Dr. Iheme will come and tell us, look, this is what we found out. Otherwise, if the government is trying to maybe use politics to say, look, this is not, under this present circumstance, we must be able to probe what has led to the death of these people.
Okay.
And I am so, my fear is COVID-19 could possibly be one of them.
All right.
I'm not saying all of them died of COVID-19,
but underlying
yes,
health situation.
Exactly.
It's all right. But then, you talked about testing earlier, scaling up testing capacity and all of that, which has been done. Anyway, you think we need to do more. Neighboring Senegal continues to record a high recovery rate, thanks to homegrown solution in terms of testing and all of it. Is this what Nigeria is missing?
Definitely. Like
homegrown solution.
Yeah, homegrown solution. I think that the present practice of adopting what we call the polymerase chain reaction kind of test. Like I said earlier on, these are gold standard. These are actually acceptable the world over. But the limitation we have with the PCR kind of testing is because it has it cannot only capture a limited number of people at a time, number one. And then number two is because what we call the turnaround time is about 48 hours. And then of course it is very expensive. It's very expensive. It is capital intensive and all that. Now, if we can actually adopt what some other countries are doing to scale up the tests, I am thinking that should also go a long way. Yes, for instance, we're looking at the rapid diagnostic test. Now, if we can scale up, because that actually tries to plug the loophole. It's able, that one does a lot of tests at a particular point in time. It may have its own problems, its own challenges, in the sense that it may not be able to, it's not as standard, it doesn't give you 100% as accurate results as the PCR own counterpart does. But the good news about is that it's able to do what it tests a larger number, it's able to rule out the negative ones, and this is a burden on the system.
All right, thank you there. Now, in his last broadcast, Ibrahim Modibo, the president explained that defeating COVID-19 is a task for all of us. How much more needs to be done by the man on the street to ensure that we win this war?
Thank you. Before I go to this fundamental question.
But you have a very short time.
Of great importance.
We are running out of time.
Yes. I want to appeal. If Senegal, a country of no more than 20 million or thereabout, could be able to go into a homegrown solution or trying to find test kits based on scientific experience of their academics, what is ASU doing? What are your university professors doing? It is not all about having salaries every time increase. No, this is a time, this is a challenge. The university professors of Nigeria are one of the best in Africa, in the whole world.
Do they have some of the best to do this?
No, of course. What if Senegal could have it? Why can't Nigeria?
That is it.
So it has to be provided first.
No, the atmosphere is there. But honestly, I'm saying, if Senegal, a relatively very poor country with per capita income that is not comparable to Nigeria, and in terms of population and intellectual capacity, because in Nigeria we have all the brains you can think of in the world.
Absolutely.
Everywhere you find Nigerian doctors, everywhere in the world.
Remember, I'm running out of time.
So if our scientists, if we could have doctors like this, I want to challenge our university professors to come up with a solution. Give us the result. Let us break the ice cake.
Okay.
Let Nigeria be the first country to discover vaccines or medicine of COVID-19. I'll be very proud of the university.
All right, you'll be very proud. Dr. Iheme, I've completely run out of time, but I'm gifting you the last 30 seconds I have.
It's all right.
Now, given all the information at your disposal, what is your expectation going forward?
My expectation is that we are going to scale up the tests. We're going to do more tests, and then more information will still come. I mean, people, if whatever the pattern of the lockdown that we're going to take is going to enable us to do more of introspection, look at what's the best approach. We've done the first 4 weeks. What are our problems? Why don't we achieve whatever target we have set for ourselves? Now, if we take whatever extra weeks we're going to do, now we're going to look at the mistakes of the past and try and better it in the future. And I'm sure by then, the curves we all be talking about will start flattening, and then we shall start seeing improved rates as far as the cases are concerned.
Dr. Iheme Ogbonnaya, thank you for coming on Nigeria Today.
Thank you, Azu.
And Ibrahim Modibo.
Thank you.
Thank you very much for being on the program.
Thank you.
Nigeria Today returns same time tomorrow, but you can watch this and other editions of the program on www.youtube.com/NTA News 24 Hub. My name is Victor Azo. Thank you for watching.